everyone. My name is Molly McQuinn. We're here today representing Texas Health Resources. Thank you so much for being here. We really appreciate it. So today we're going to be talking about our diabetes prevention program, which we would like to invite the Dallas Chamber to join in our fight to eliminate diabetes as an issue in the Dallas-Fort Worth area. So why diabetes? Diabetes is a very important issue worldwide, in fact. In 2016, the World Health Organization published their global report on diabetes. In this report, they mentioned that as of 2014, 422 million adults worldwide had been diagnosed with diabetes. Another number that they threw out there was that 3.7 million deaths occurred throughout the world as a result of either diabetes or high blood glucose levels. Now, a lot of these issues came up in low-income areas or areas that were impacted by high poverty rates. And so that is also, unfortunately, an issue that occurs in the Dallas-Fort Worth area. So the Texas Health Resources has partnered with the American Diabetes Association since 2011 in an effort to eradicate this issue within our community. In 2016, we published the Community Health Needs Assessment, in which we identified diabetes as one of the top 5 health concerns for the Dallas-Fort Worth area. Moving forward in 2017, we would like to partnership with the YMCA of Greater Dallas, as they already have in place a diabetes prevention program. We're here to talk about the specific locations that hold those programs and the areas they impact are my colleague Farouk.
Hi, I'm Farouk. We make advanced research to figure out those areas impacted by the diabetes. So what we figure out is in the DFW area, we got like 2.4 million people who have diabetes. And among all those 2.4 million people, 11.4% are located based on those 4 zip codes. So the top zip code, we have northeast area of the Dallas, and those zip codes correspond to the Mesquite area. So among all those areas, we have like 34%, 50% of those areas, we realize that the Spanish population have more percentage of diabetes. So I will pass to Ms. Harris to discuss about the proposal.
Actually, Tina and I will be discussing the proposal. Before I get into the proposal, I would like to let you see how the actual diabetes testing is done. And I'll invite Alexa up here to show us how the diabetes testing will be done. In order for us to do the testing, we require a glucometer machine. The glucometer machine requires testing strips. Those are the strips that go into the machine. We typically use any of our 5 digits to do the finger stick. We need an alcohol swab to do the finger stick. She'll go ahead and prick the side. We only need a small droplet of blood to get the reading. It takes about 1 minute. A normal blood sugar reading should be anywhere between 70 and 110.
So this reads 78 right now. Slightly hypoglycemic, not dangerous.
So that would be considered within normal limits. For our proposal, Through simple testing such as that, we will be able to identify cases of diabetes that may otherwise would have gone undetected while they are still treatable. The education we provide the community will serve to promote awareness of the root causes of diabetes as well as the preventive measures. If a case of diabetes is detected, we will provide the initial treatment supplies such as the glucometer, testing strips, and the sliding scale that they'll use to provide the insulin, as well as a treatment plan that will be put in place to suit the new patient and their needs. The community will be educated on prevention measures such as the diet, exercise, and the signs and symptoms they will need to look out for, while also promoting a healthy lifestyle for the Dallas community area. For our next slide, we will discuss about the timeline. This event is scheduled for May the 27th at the Park South YMCA located at 2500 Bromine Avenue in Dallas. Flyers will be distributed 2 months prior to the event to create the awareness, and there will also be announcements made in the churches in that community. Our location, as we determined, will be at the Park South YMCA. The YMCA has graciously provided the venue as well as the fitness instructors who will be conducting the care plan for those who will be needing an exercise plan. The testing will begin at 8 o'clock in the morning and will be conducted by our team of Texas Health Resource volunteer nurses. There will also be nurse practitioners on staff that will be prescribing the insulin, as well as giving the doctor referrals to those who will be diagnosed as diabetic. The nurses will create profiles for all those that will be tested, and this will include their baseline vitals such as their blood pressure, temperature, and their blood sugar, and they will follow up with these patients for 6 months to see how their progress will be. Patients who will be provided the opportunity to register in the Diabetes Prevention Program will get the follow-up treatment. And now I'll hand it over to Iris to discuss about the budget.
Thank you, Tina. As my colleague mentioned, we will have volunteers, and our partnership with YMCA will provide the space needed. But as we know, medical supplies are very expensive, and our initial budget is going to be for the medical supplies that we need for the medical testing. Therefore, we are asking for a one-time donation of $20,000. 75% of it will be for take-home starter kits. These kits will consist of pamphlets, education material, and additional testing kits for patients that are diagnosed so they can take it home. 15% of it will be for compensation if we don't have enough volunteers. And 10% will be for any additional resources that we might need. And now my colleague David, he will talk about how we will measure our success.
Sorry. So if you've ever known somebody with diabetes and struggled with it, say hey. Hey. And if you want to know how we're going to track the impact of our project, say ho. Oh. And I can tell. I knew it was going to be worse. So we're actually just going to track it pretty straightforward. We want to know exactly how many people we tested. Of those, how many people actually had diabetes. It's going to give us an idea of actually what the statistical diabetes rate in that community is.
We're going to use all of these measures of success to actually craft a better approach to low-income diabetes prevention and treatment. Hopefully, this project is just the beginning in a long and successful fight against diabetes in the Dallas area communities, particularly low-income communities. We need to know how many people we had taking prevention classes. Preventative medicine, everybody knows what that means, right? It just means it's better not to get sick than to get sick. It's pretty straightforward. And the number of our new cases who actually do continue to get care for themselves, as opposed to how prohibitive is the actual cost of diabetes treatment. So that's going to give us some good data as far as how to better serve our community. Next slide.
Sorry.
David's gonna finish up with that.
Yeah, all right, basically what we need to do here is we're gonna try and declog our healthcare network. So, anytime we have too many people coming into the emergency room because the foot's turned black and it's about to fall off, we're taking emergency room surgery time away from people with severe trauma, bleeding, this, that, the other, things that they can really die from right then and there. And honestly, it's entirely preventable. And so our goal here is to provide better health care to our low-income Dallasite community. So we need to remove our financial roadblocks from anybody that's coming in here. So everything that we give them is free at the beginning. We're paying for all of that. And we'd like to make sure that they have those options for continuing care. Are there any questions?
Any other concerns or issues that you might have, you can always follow up with various YMCA locations, any other Texas Health Resource locations as well. Yes?
So these were going to be located at, you said the community events or churches?
Correct. Yeah, well, they're going to be at YMCA locations who foster the diabetes prevention program. So our first project is going to take place at, as she said, the park location. And then if that proves to be successful, as we definitely hope it will, then we'll try to expand it on a monthly, if not weekly basis to other locations that also foster that program. Yes, sir.
What exactly do I receive if I attend one of your events?
So upon arriving at our event, we wanted to create awareness prior to the event so that we can have patients coming in who have fasted appropriately. So upon arriving at YMCA, we will make sure everything is in order health-wise. You know, if there's any concerns there, we'll go ahead and test you. If you do prove positive, then we will guide you to any programs or assistance that you might need. And then if not, then we will give you a packet of information to take home, give to your friends and family, and spread through the rest of your community as well. Yes, sir.
What's the cost per test?
Cost per test. That is actually not a number I have on hand, but I'm happy to get that to you as soon as possible. All right. One more question?
How much does one unit cost?
A unit of insulin?
The little,
glucometer machine?
yes.
It's about $80.
All right. Well, thank you very much.